Due to the pandemic, and to avoid the healthcare-associated infections, we developed an AI cloud service, called Immune.us, to monitor the infection risks of COVID-19. The AI algorithms behind Immune.us has been inspired and proven by hundreds of prestigious research papers, and has integrated more than 40 parameters, including the infection rates and the vaccination rates of the local population. Therefore, after tuning up the parameters, Immune.us can not only be used for COVID-19, but also be used for other respiratory diseases. Now, let's introduce how Immune.us works. First of all, let's talk about HAI. HAI, also known as healthcare-associated infection, is an infection that is acquired in a hospital or other healthcare facilities. On any given day, about 1 in 25 hospital patients have infections caused by the medical care. Among all the HAIs, 15% are coming from lung infections. The lung infection comes from coronavirus, Staphylococcus aureus, tuberculosis, and many other important diseases. The major transmission path of lung infection is through small particles suspended in the air, called aerosols. The infectious pathogens may be spread through breathing, talking, coughing, or sneezing. How to monitor the concentration of infectious aerosols? The answer can be found from carbon dioxide. In a normal room, human breaths are the only sources of carbon dioxide. The longer the time of stay, the more carbon dioxide is generated. On the other hand, the ventilation system can take carbon dioxide outside the room. So, if we can monitor the carbon dioxide, air exchange rates, and occupancy parameters, it is possible to predict the infection risk of the disease. That is what Immune.us is doing for you. After installing an air risk monitor, it continuously watches crucial parameters and uses its AI system to generate the risk of infection for COVID-19 or other diseases. Besides, Immune.us will monitor if the room temperatures, humidity, and HVAC/ACH values are compliant with ACE-RAY guidelines. If the risk exceeds the threshold or is not compliant with ACE-RAY guidelines, the cloud server will alert the key staff with text messaging or smartphone applications, or show up on the digital floor plan of your Immune.us portal, and notify the Cello Omni purifier in the same room to remove the extra contagious aerosols. Other than healthcare, Immune.us was also proven in schools, offices, and conference rooms. With Immune.us, healthcare managers are no longer in the dark. They can visualize the risks before they happen, and prioritize the resources to prevent the potential infections.